Good day and welcome once again to the afternoon update here at the Information Command Center at the studios of the Government Information Service. We are on NTN as well as the Government of St. Lucia's Facebook page, YouTube, and WVENT 93.5 FM. It has been quite an eventful week thus far as the government embarks on positive initiatives as the country begins to open up post-COVID-19. The country is now in recovery mode, despite the fact that the various protocols regarding physical distancing and a midnight to 5 a.m. curfew remains in place. Let us first take in the latest update on our country's status from our Chief Medical Officer, Dr. Sharon Belmar-George.
As of June 18, 2020, the World Health Organization reported a total of 8,242,999 confirmed cases of COVID-19 globally, with 445,535 deaths. Within the region of the Americas, there was a total of 4,015,386 cases. Testing results received on June 18, 2020 indicated 35 negative test results. A total of 1,484 tests have been carried out to date, and the recorded number of confirmed cases remain at 19. 18 of those cases have fully recovered. The last positive case was recorded on June 4, 2020, making today the 15th consecutive day that all tests conducted have returned as negative. As we continue to live in this COVID-19 environment and adapt to the new normal, we remind the public on measures to remain and to maintain their mental health and to stay healthy. Keeping healthy is extremely important during this time and will ensure a strong immune system to increase your chances of preventing and fighting the disease. These measures include eating a healthy, balanced diet, including fruits and vegetables daily, regular intake of water instead of sugary drinks and beverages, regular exercise. Persons with chronic diseases must ensure that they remain compliant on their medication. Avoid alcohol abuse, avoid smoking as it leads to lung damage and further exacerbates respiratory illness. Avoid stress and develop stress management habits. Visit or call your healthcare provider if you have any health concerns. The mental health impact of COVID-19 has been well documented. It ranges from anxiety, depression, to suicidal ideation. All age groups are affected, as life changes have been drastic in many cases. The new reality of working from home, less social contact with family and friends, homeschooling for children, and being unemployed is actually a difficult time for most persons. Persons are encouraged to seek help at the National Mental Wellness Center, the 201 helpline, or from trusted family members and friends if needed. We advise that parents monitor and manage children who may be trying to cope as well. Also, persons should try to provide support to family and friends who may not be managing well to the COVID-19 environment. The Ministry of Health and Wellness, we will continue providing you with regular updates on COVID-19.
Thank you, CMO, for that update and our regular reminders. Continuing with our daily updates, on Tuesday, June 23rd at 4 p.m., Prime Minister Honorable Alan Chastanet will table the Appropriation Bill 2020-2021, also known as the Budget Address. The address is being held under the theme, New Challenges, New Opportunities to continue to build a stronger St. Lucia together. This follows the laying of the estimates of expenditure for the new financial year on Wednesday, 29th April 2020. Next Tuesday's budget address holds extreme importance for St. Lucia as it will set forth the policies and plans for achieving sustainable and inclusive growth, development over the medium term, focus in on key sectors, and outline the plans for St. Lucia's economic recovery amidst the COVID-19 pandemic. The tabling of the Appropriation Bill 2020-2021 and the delivery of the budget address will be carried live on cable television via the National Television Network, and the public is also invited to tune in via the Government of St. Lucia web portal, www.govt.lc, the Government of St. Lucia Facebook page, the Government of St. Lucia YouTube channel, as well as the Government of St. Lucia audio stream on tunein.govt.lc. Also making the news this week, with the reopening of the borders and various protocols being put in place for taxi drivers, this week the government unveiled the protocols for the taxi sector. According to Tourism Minister Honorable Dominic Fede, valuing the contribution of this subsector, the Ministry of Tourism, in collaboration with the Department of Health and Wellness, conducted various consultation meetings with taxi and rideshare operators and have outlined the necessary protocols for operation during the phased opening of the tourism sector, which commenced on June 4, 2020. The Department of Tourism has since launched this PSA outlining the protocols for the taxi sector.
In mitigating the possible spread of COVID-19 into our communities, the following tourism-related health and safety protocols must be observed during the deployment of taxi and rideshare services. Drivers must wear a face mask at all times. The official COVID compliance obtained through the Ministry of Tourism must be displayed when on duty. No shaking of hands. A gentle nod or elbow greet will do. Hand sanitizer should be offered to guests prior to entering the taxi. Electronic methods of payments are encouraged as an alternative to cash transactions. All guests must keep their feet on floor mats and wear a face mask throughout the journey. Drivers should sanitize hands before and after any possible contact. Installing a plexiglass is highly recommended as an added layer of protection. For more information, operators should visit the Ministry of Tourism's website at www.slutourism.govt.lc or call 468-4603 or 468-4628. This information is brought to you by the Ministry of Tourism in collaboration with the Department of Health and Wellness. Securing lives, restoring livelihoods.
And at this point of the reopening of the sector, the objective is to secure lives and restore livelihoods amid the COVID-19 pandemic. As such, the Ministry of Tourism will continue to work closely with tourism transportation providers in ensuring that they are equipped to execute their duties in the safest possible manner so as to mitigate any possible spread of the virus into our communities. For this reason, additional training in COVID-19 compliance will be held in the coming days through the taxi companies and association. And a reminder that for more information, you could visit the website stluciatourism.govt.lc, or you may call 468-4603 or 468-4629. This week, we also saw the launch of a brand new promotional video for the island as we prepare ourselves to welcome visitors once again to our shores. The Global Tourism Campaign is one of the international marketing components of St. Lucia's phased COVID-19 Responsible Reopening Plan. The campaign targets all of St. Lucia's key international and regional tourism markets through various marketing initiatives. This video, called She is St. Lucia, Let Her Inspire You, gently reminds travelers that we offer the natural treasures and renowned culture that they seek. This is one stage of an overall plan to remind the world about our renowned beauty and the care St. Lucia has taken in getting ready to carefully welcome visitors back with open arms. Let's take a look.
She's been watching, waiting, wondering when the sands of time will give way to a tide of change, and for yesterday and today to become a new tomorrow, for a time when her sun can kiss the cheeks of your loved one and her stars can twinkle in her honeymoon skies, when her earthly embrace will reassure and calm your soul, and her unique view can change your whole perspective. Proudly, she has risen to meet new challenges and to provide safe harbor to all who reach her shores. For her hopes and dreams still stand shoulder to shoulder, a precious reminder of experiences yet to come. So, wherever your moments and memories take you, let her sense of adventure set you free. She is St. Lucia. Let her inspire you.
And not only are our visitors anxious to return to St. Lucia once again, to return to this majestic place, but we also have several of our nationals who've been stranded overseas longing to return home. And on this subject, more St. Lucians are being repatriated. We have 168 more nationals returning home. The government of St. Lucia on Friday, June 19th, welcomed home 168 St. Lucia nationals who are employees of the Norwegian cruise line. The Department of Health and Wellness have granted permission for the arrival and disembarkation process of the MS Marina at Port Castries, following which the vessel will depart St. Lucia. All returning nationals will be screened by Port Health personnel and transferred to a government-operated quarantine facility for a period of 14 days. To date, efforts by the government through the Department of External Affairs and its representative offices, the Ministry of Tourism, the St. Lucia Tourism Authority, and the Ministry of Health and Wellness, along with other relevant agencies, have resulted in the successful repatriation of 616 nationals, which will increase to a total of 784 upon the arrival of the MS Marina today, Friday, 19th June. Efforts are also ongoing to ensure that stranded nationals in Europe, the Philippines, Dubai, Brazil, and Mexico, along with others in North America and the Caribbean region, can be brought home soon. Nationals are reminded to liaise and register with the nearest St. Lucian embassy and consulate, along with the Office for Diaspora Affairs. And in our final update today, the World Health Organization hosted the virtual launch of the inaugural Global Report for the Prevention of Violence Against Children. And St. Lucia, through the Department of Health, was in attendance. The Ministry of Health was responsible for compiling and submitting our country's national report. And now the action is to follow, to act in the interest of our children and to make more significant strides in achieving Sustainable Development Goal 16 to achieve justice and the protection of our children. Children face a range of abuses in all countries, including ours. They range from the entire spectrum: physical, sexual, or psychological violence, suffering injuries, disabilities, and even to the point of death in some instances. It is important at all levels of social interaction and across all institutions that strategies are put in place and actions taken to end violence against children. Let us start with each of us right now. Let us take heed to the needs of all our children today. On that note, we take a short break, and when we come back, you'll meet our guest as we observe Sickle Cell Awareness Day, June 19th, 2020. Do stay tuned.
As part of government's social stabilization plan to assist persons who have lost their means of earning due to the COVID-19 pandemic, the government of St. Lucia has implemented the Income Support Program, where non-contributors to the NIC shall receive a monthly payment of $500 for the next 3 months. Taxi drivers, jet ski operators, vendors, agro-processors, tour guides, hairdressers, barbers, small bar and restaurant operators, construction workers, and other sole traders who meet the criteria can apply using the Government of St. Lucia's website, www.govt.lc. Payments will be made directly via electronic transfer to the recipient's bank account. The Income Support Program, simple strides towards recovery.
And welcome back. The St. Lucia Sickle Cell Association recognizes World Sickle Cell Day, June 19, 2020. The Sickle Cell Disease Association of America announces the observance of the first annual Sickle Cell Disease World Day, and this day of observance was a product of December 18, 2008, a United Nations resolution that called for the recognition of sickle cell anemia as a public health problem and one of the world's foremost genetic diseases. The resolution called for member states and the organizations of the United Nations system to raise awareness of sickle cell anemia on June 19th of each year at the national and international level. To discuss the importance of focusing on sickle cell diseases and the work of the St. Lucia Sickle Cell Association, I have with me Ms. Sophia Henry, President of the St. Lucia Sickle Cell Association. Welcome once again. As well as Nurse Francilia Lubrin, who is part of the fundraising committee, the St. Lucia Sickle Cell Association. Welcome to both of you.
Thank you.
Thank you.
Okay. First of all, maybe you could refresh the memories of our listeners, our viewers. I know you were here a couple of months ago. Just what exactly is the Sickle Cell Association all about?
Good afternoon, listeners. And first of all, we would like to thank GIS for inviting us here. Okay, yes. St. Lucia Sickle Cell Association. Well, first of all, it was first founded on the 7th of September, 1987. So this year, in September, we will be celebrating our 33rd anniversary. Now, some of the objectives of the St. Lucia Sickle Cell Association is to educate patients and parents of persons suffering with the disease. It is to provide resources for persons interested in sickle cell disease to learn and understand about the disease. It also helps to create a forum to share experiences, psychosocial and socio-economic problems. It improves the standard of care and management of persons living with the disease.
Okay, maybe Nurse, you could probably tell us a little more about what exactly is sickle cell anemia.
Sickle cell disease is a genetic condition where a child receives 2 sickle cell genes, one from each parent. And a person with sickle cell can pass the disease to his or her children, but it's not contagious. Now, if you have a parent, let's say 2 parents that have the trait, like they have the sickle trait, you will find if they have four children, 1 would be normal, 2 will have the trait, and 1 will have the disease. So it's like a 25%.
Okay.
Now, if you find 1 parent with the disease and 1 with the sickle cell, 1 with the trait, you would find it's a 50%.
50%.
2 with the trait and 2 with the disease.
How prevalent is sickle cell here in St. Lucia?
Yeah, pass to the president.
Okay, well, in St. Lucia, we have approximately an estimate of about a little over 600 persons
living with
sickle cell disease. Some of them has the trait. So in the office, we don't see many persons coming to visit because most of the people, they don't really suffer, you know. Those with the full-blown sickle cell, those are the ones that we normally see on maybe a monthly basis. Yes.
Why is it important for persons living with sickle cell anemia to register with your association?
I will say it is important because there are times that they really do need assistance. Some people, they may need just a little moral support. Some people may need counseling on how to care for the disease and how to prevent themselves from getting a crisis. You know?
Given the focus today is on World Sickle Cell Awareness Day, how is your association, how are you marking this day?
Well,
we started with activities, different activities.
Yeah.
For example, on it was Monday.
I think.
Yeah, we had a presentation with parents at the Castries Health Center, telling them about what the sickle cell is all about, the treatment, the symptoms, how they can get resources, who they can get through, and plus give them information for like those who getting pregnant. We talk about that, what they can do, how they can go to genetic counseling, what they are expected during the antenatal and postnatal during pregnancy, all that we told them. And we gave out literature. Then hampers were given out.
Okay.
Yes, during the week.
Talking about hampers, what sort of funding, what sort of support do you get? Because I know that you depend on donation, subvention, or what have you. What is that like for the association?
Okay, well, one of the main support that we get is the government subvention. Yeah. Other support, some banks, for instance, we have CIBC, First National Bank. We also have persons come in and give us a little donation of clothing.
Okay.
You know, but we're really in great need of persons to come in and sponsor.
On June 14th, we also observed World Blood Donor Day. And during one of our programs, we'll discuss the importance of St. Lucians to give blood. And among the many recipients for blood donations are persons living with sickle cell anemia. Just stress the importance of that one more time.
Okay, persons suffering with sickle cell. Well, let's talk about the red blood cells. Okay, now the red blood cells in a sickler, they're sickle. Now there's a difficulty for that blood cell to move around. So that is how persons normally get crisis, and that can cause blood clots. It can also cause stroke.
Okay.
So when a patient is in hospital, they may be going through all of these crises. They will need blood transfusion. So it's important that persons donate blood.
Okay, nurse.
Especially when the person is pregnant, because you find at that time, that's the time they need more blood. Okay, so they are anemic. Okay, so they need the transfusion. Like she said, when the cell is sickled, like you see the moon, the quarter,
shape,
the shape. Now the oxygen cannot carry the oxygen it needs.
Okay.
Now you find all sorts of complications, strokes, people blindness, and there are also complications like it leads to the organs where people get liver damage, their kidneys damage. Yeah, it also affects the heart. And some persons you would add to that have the disease, you'd actually see the ulcer. They would have the ulcer. Now, they have babies in the children. They will have swollen limbs. Their hands, you'd see all their fingers, their hands are swollen.
Okay.
Yeah.
So this is another very, very important reason, among the many other reasons, why we continue to urge persons to donate blood to the blood bank here in St. Lucia. Let's take a look at a short video on the 10 facts about sickle cell. That video there, of course, emphasizing some of the things that we have been discussing as far as persons living with sickle cell. What are some of the myths? Because you mentioned earlier on that it's not something that's contagious. What are some of the other things that you know that persons are saying that may not necessarily be true when it comes to persons having sickle cell anemia?
Because some persons believe that sicklers cannot live a normal life. Mm-hmm. There are certain things like in sports, like they cannot participate in the athletic part of sports, which they can't. Okay.
Do you see any cases of persons having sickle cell anemia being discriminated against in terms of when they have to apply for work and what have you in St. Lucia?
Not what I know of.
Mm-hmm. Yeah. There are cases, you know.
Ms. Henry?
I don't know.
Yes, I would say that there are cases because I come across young people who have the disease and they complain all the time because they won't be able to work at the speed that a normal person would. Right. So they don't normally get work.
What do you think is necessary so that we could overcome that hurdle so that we embrace persons living with sickle cell anemia?
I believe it's to educate, more educate the doctors, the nurses.
Yes. More awareness of the public of what it really is, so that they would see these persons and know that they can live a normal life, but it's not at the same pace if somebody doesn't, who has the disease. Because, for example, these persons would not, a high altitude is dangerous for them. Whereas with you can just, it's dangerous. These persons would go to the beach. You would see some of them well dressed up because the moment they get too cold, that's when it triggers the painful crisis.
Okay. So, in light of COVID-19, how has the association been coping in terms of reaching out to members and some of your campaigns?
Okay. Through WhatsApp. They have sent in information. Dr. Bird, at the other time, Dr. Bird sent in information because the association has a WhatsApp group. So Dr. Bird sent information, and any other information that comes in, it goes to the members through the WhatsApp group.
Okay. What sort of work have you been doing with school children as an association?
As of now, we have not started, but we're in the process of sending emails to the doctors, and post-COVID, we'll find out whether they will be able to go into the schools to educate the children on the disease. And I have been doing outreach programs, and I've been going door to door in the neighborhood, because I believe you have to have an impact in the community that you are in. So I've been going out. I met with a few children, and we also will be having a little arts and craft for them, the entire month of July, and we will be adhering to all of the protocols. Yes.
Talking about door-to-door, how many persons do you have working out in the field with you?
Well, as of now, just myself and the secretary.
Okay,
Yes.
well, that's a lot of ground to cover, just the two of you.
Yeah, we may not be able to cover the whole.
So at this time, are you
Yes.
looking for persons to volunteer with your association?
Yes, of course, yes. I also got some parents in the neighborhood who are willing to help.
And for persons who are interested, how could they reach out to you?
Well, they can call us. They can call us at 453-1011, and that is on Monday to Wednesday from 9 to 2. They can also call at 485-2355. They can call at any time. They can also get in touch with me, 284-6736 at any time. Yes.
Okay.
Or
We'll
they can
also
come to the office, which is
yes.
situated, that's at the back of the
The
Fatima, Our Lady of Fatima Church,
The
the presbytery.
The clearing.
As in Leclerc?
Yes.
Leclerc, okay.
Yeah.
Okay. All right, well, we take another break, and when we come back, we continue the conversation on this World Sickle Cell Awareness Day. Do stay tuned.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Use organic and join revolution.
Excessive agrochemical use, additives, and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy, and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
And welcome back. Today we are discussing sickle cell awareness, and in studio with me is Miss Sophia Harry and Nurse Francilia Lubrin. Nurse, probably you could tell us about the symptoms of someone having sickle. What do we look for?
They are anemic. In babies, the babies get irritable and very fussy. They, like I said before, their hands will be edematous, their limbs. We have persons being very severe. They are tired. Some people having severe fatigue. They have frequent episode of pain, which they call the sickle cell crisis. Frequent infections, that's why these persons are very vulnerable to infections. Where persons have the flu, they have to stay away, especially the COVID. They have to stay away. Delayed growth noted in children and adults. Vision problems.
And how is that treated?
Well, they go to their physician. With the painful crisis, they get what they call analgesic, and they receive morphine or pethidine. They also get this drug they call
Hydroxyurea
and
pneumococcal.
Are those drugs and painkillers readily available in St. Lucia?
Yes.
Okay.
They receive it free.
Okay.
Now the doctor who is responsible for this is Dr. Ogulusi. Yes.
Based where?
Castries Health Center.
At the Castries Health
Yes.
Center.
Yes.
Okay.
She attends to the children with sickle cell.
Okay. But for adults who might be seeking help, where do
Adults,
they
we
go?
have Dr. Bird she's willing to see all of the adults. You just have to call first,
Okay.
and Dr. Bird attends to them.
All right. Let's talk about the activities, especially fundraising activities, which is very vital for the association. What are some of those you have coming up?
Okay. As of now, we will be having a yard sale. That is on the 30th of June in the car park, the Leclerc Church car park. And that yard sale will be starting 9 a.m. onwards. And we're inviting persons, especially who live in the area, to come, because this yard sale is going to be grand. Okay, things are going to be reasonable, so we're asking. And one of the reasons why we're having the yard sale is to assist our members, especially those who are less fortunate around this time. Okay, and we're looking forward to having post-COVID, maybe a barbecue. We normally have movies on one of the cruise ships that come on port. So in future, we'll be letting them know what's going on.
In terms of the association, are you only open to membership by persons who have sickle cell, or are you just open to persons willing to come and give up their time, volunteer with the association?
It's open to everyone. Whoever would like to be a part can come too, because like we said before, we need volunteers, we need persons to sponsor, you know. So we're open for all those.
Do you get a lot of support from parents who have children with sickle cell?
A few parents, yes, come out.
But I would also imagine that even in terms of the parents, you need to have the support system for even parents. How do they manage and care for children with sickle cell?
Yes, well, we have a few parents who come in and we do a little counseling and we show them how to check on, because normally the children, maybe Francine can talk about the spleen. Parents have to be able to feel the spleen. Yeah, you want to talk about that?
Yeah, because if it's swollen, they feel it. They know they have to bring in this child.
All right.
Yes.
What are some of the other problems that you see as a nurse going around?
Yeah, the sickler who has a baby, the child has a low birth weight. Yes. Now, the medication they would, because some of these sicklers that like on they have hypertension. Now the AC liters they will be taken in. While they're not pregnant, they cannot take it in again. Because if they take it, it can cause miscarriage. Some of these very medications they are taking while they're not pregnant, they cannot take it while they are pregnant. So they have to prescribe a new set of medication for them.
What would you say in terms of the education process, informing women before they get pregnant, that they are aware, even in terms of their blood type, their partner's blood type, or what have you? What is that education process like here in St. Lucia?
Well, they are advised, I know through, when these persons come for pre-counseling, they are advised to go to get genetic counseling about this baby.
And when is that genetic counseling available?
First, they have to do the electro Hep B test to know the status of whether they have sickle cell or not.
Okay.
Which is available at the hospital. You can go at the hospital. The doctors would be one of the resources that will tell them.
Okay. Yeah. I think Miss Henry wanted to come in here.
She said it.
About the genetic
the status.
counseling.
No, the status.
And during the antenatal period, these persons, when they know the electro Hep B of these persons, now they have to refer them to the physician to take care with that, because all during this time these persons have to be closely monitored. Especially if both parents has the trait, or one has the disease or one has the trait. Now the genetic counselor will be counseling them about whether they would go on with having a child, because they will tell them if that person have the trait and this one have the disease, obviously it's a 50-50.
Right.
Now you have 4 children. Would you want to have 2 children with sickle cell disease? That's a load on your hand.
Right.
Yeah. So they would weigh
the
options. Know whether they want to go on and having a pregnancy or just adopt a child whereas the one with the trait would be consulted, and they would know that one will come out normal, two with the trait, and one the disease, the full blown. So through that they have to weigh out the options and know what will they want. Now, if they get pregnant, the first pregnancy, yes, it goes through. They have the antenatal process. They have to, when they reach at hospital, the intranatal process, they continue with them, the postnatal process. Now, in doing that, they have blood tests being done to see if they need blood transfusion at that time.
Okay.
And you think of it, if a woman, a sickler is pregnant, after they having labor pain, to be in that crisis again, all their joints hurting them. And
that's double crisis.
That double crisis. So before they go through that period, they have to be educating.
All right, so it's very important. That is very, very important.
Before they go through that period. And they advise also in not, they don't really encourage them to have children after.
Okay, all right. We have a second video that we need to take a look at. This one is from the U.S. Surgeon General.
I'm United States Surgeon General Jerome Adams, and today marks World Sickle Cell Day. It gives us all an opportunity to raise awareness and understanding of sickle cell disease, or SCD. Did you know that SCD occurs among 1 out of every 365 Black or African American births? Blood centers across the country are in critical need of Black and African American donors to help those battling SCD. So I ask that you consider making an appointment with your local blood center today. Centers are practicing social distancing and good hygiene, so donating is safe. Join me on this World Sickle Cell Day in my call for a diverse blood supply that can help our friends, family, and loved ones who have sickle cell disease.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.
Again, earlier on, you were mentioning the prevalence of sickle cell anemia in St. Lucia, but in that video we just heard the prevalence of sickle cell anemia even amongst the high rate among Black people, and being what obtains here in St. Lucia as well.
Yeah, because sickle cell, it affects everybody, but it's at a higher rate in African, in African, Hispanic.
Okay. Okay.
Yeah.
In terms of going forward, what would you like to see happening in St. Lucia in terms of creating the awareness, in terms of persons living with sickle cell anemia? What would you really like to see happen, as a nurse in particular?
That there is more education on it to those who don't know, through the media, through when they come to the hospitals, the health centers. Yeah.
Do you think it's because we've heard about sickle cell for years now, but it's something you just hear people saying, but do you think it is because there's a lack of understanding of what it is?
Because they have they have certain persons who you would ask, do you know, let's say, the person say, like somebody else said, you know, a sickle cell, and right away they believe like it's a disease that, you know, it's like a contagious disease. It's something like, because you have sickle cell, like you're just going to die. Because I remember that time growing up when I was in secondary school, and I remember there was a classmate of mine, and I never knew what sickle cell was. And I saw the fella come in, he had an ulcer. And there was also a girl that always used to be crying. You seen her eyes getting yellow, because that's one of the symptoms, the eyes getting yellow. So there's jaundice. And we wouldn't want to sit by this boy because he had the ulcer and would find that being the girl crying. And as I grew up into an adult now, I know what I was seeing.
And what you were hearing as well from other persons.
So it should be also in schools, because the same way, I didn't know, the same way in the schools, you know, the children might see probably a little one, especially in the, we'll start from the daycare setting, that the daycare persons should be educated about that.
Right.
Because probably they might see the child fussing, and try to fool the child with formula or breath, or feed the child, or thinking is like sleep, the child want to sleep, and sometimes it's just that. So they tell them about what they expect. So they start with the preschool, then they go to a primary up to secondary school.
Okay, all right.
Yeah.
Final words from you, Ms. Henry, as we're about to wrap up.
Okay, one thing I would like to bring to the attention of the public. We will be hosting a chronic disease self-management workshop. And that is, you know, in the next few months, we'll be letting persons know about it. And we would like to know, persons who are interested, we would like them to give us a call so we can register them. And remember, our number is 453-1011 or 485-2355. And that is, you know, to improve the standard of care and management of persons living with the disease. We'll be covering a lot of topics.
Okay.
Yes.
Right. Nurse?
Yeah. Okay. All right, final word to the public. Know both you and your partner's sickle cell status. If you suspect you have it, you seek genetic counseling if wanting to have a child. Talk to your health provider about it. Those who are pregnant, take your antenatal visit serious. Take only medication prescribed by your health provider during pregnancy. Stay as much as you can away from persons who are sick, for example, the COVID and any other infection. Keep hydrated by drinking plenty of liquid. Take your folic acid. Ask questions when you cannot understand a treatment. Get plenty of rest and try not to stress yourself too much.
Okay, thank you so very much, Nurse Lubrin, and thank you as one of our frontline workers for all that you're doing.
Thank you.
Do continue to remain safe, you and your family.
Thank you.
And thank you, Ms. Sophia Henry,
Thank you.
for your hard work and dedication, and I hope that you continue to get all of the support that you need.
Yeah.
Okay? Thank you, St. Lucia, for staying with us once again. Thank you for staying with us all week long here at the Information Command Center. Remember, you can join Jesse, Lisa, Carlton, and myself tomorrow morning, 9 a.m. for the Week in Review, which is always an informative and lively discussion and interaction. So do join us then. In the meantime, do continue to remain safe, strong, and positive. Remember, everyone, it's Father's Day weekend. Show some love to the fathers, of course. And until next time, that's where I say au revoir.